Okay, we can go ahead and get started. Kick it off, Alec.
Thank you for joining us today for a webinar on our latest member value partner, CareNow Urgent Care. I'm Alec Knight, the Director of Insurance for the TRA. As part of my role, I've been asked to build out our suite of insurance-related products and services that benefit our members. The challenge many members face is that oftentimes they want to offer healthcare to their employees, but they simply cannot afford to, or they do not have enough employees to take the insurance and meet the minimum numbers to get it into small group plans. We have a longstanding relationship with United Healthcare and their Healthy Hospitality program, which offers a variety of programs, including an inexpensive Healthiest You teledoc solution. However, this comprehensive telemedicine program lacks an element which is in-person urgent care. What happens when your employee has an accident on the work site, such as slicing a finger working in the kitchen and he needs stitches? Or how about when they slip and fall and need an x-ray? Urgent care services are a gap in our program lineup, and I'm grateful to close this gap with a partnership with a leader in the industry. CareNow has been a statewide allied member for several years, and their footprint has grown to include the major metros in the state of Texas and now include El Paso and the Rio Grande Valley. Today, you will learn about a CareNow medical savings program that allows your employees and their families to access affordable in-person healthcare at reasonable costs. One blessing of this program is it is more than just urgent care. It's a comprehensive program that I think you will find attractive. It's important to note that this is not true health insurance. This is a nice, inexpensive benefit you can offer to your employees and put them to help meet their many healthcare needs. As we start off, I'd like to ask you to go ahead and put any questions you may have in the Q&A box. And I'd like to introduce on our call today, Beth Tuma from CareNow and Reagan Burris from New Benefits. New Benefit is the administrator of the program. Beth, I'll turn it over to you.
Thank you, Alec. Well, we are very honored and privileged to be a new member value partner with the Texas Restaurant Association. We have been, I would say we've been attending the Texas Restaurant Association Marketplace for at least 5 to 6 years now. We always look forward to that event, and we're very thankful. We have a lot of respect for your organization, and this is just such an honor for us. I'm happy too to be partnering with Reagan Burris, who works for New Benefits, and he is going to describe the discount program in a little more detail. So, as Alex said, this is very innovative and unique. I hope you find that it will be very, very helpful for your employees. Just a little background on HCA CareNow. HCA is a 56-year-old company. We acquired CareNow Urgent Care 8 years ago. We acquired 24 clinics, and we're headed now to 300 clinics nationwide. So we started in one market, and now we're in 19 markets across the U.S. We have approximately 100 clinics in Texas and growing. We are still doing clinic acquisitions and building de novo new sites throughout Texas. Texas is one of our very best markets for many, many reasons. We also have just completed the MD Now acquisition, which really is for Florida. We should have probably approximately 80 clinics in Florida by the end of the year as well. And also Better Med, which really is located in Virginia. So we're growing very quickly. Next slide, please, Alex. So, of course, we live by our mission, which our goal for you all as TRA members and your employees is to provide the best, most high-quality care. We are very careful to vet our physicians, our mid-level providers, and our office staff to make sure that we are giving you the best care we possibly can in a convenient way. Obviously, our goal is to be the leading provider of urgent care services in the nation, and we believe we're on our way to that. We really want you to be able to return to work in a healthy way and to provide all of the treatment that you and your employees need. So we're really all about convenience, and with 100 locations and telehealth services, we are very easy to access. Next slide, please. So we are open 7 days a week, which is really nice. I don't know about you, but whenever I get sick or injured, it seems like it's in the evening or on the weekend. So we are open 7 days a week from 8 a.m. to 8 p.m. You don't need an appointment. You can use our easy web check-in link that will take you to a location of your choice, and you can request a time that is convenient for you to come in. Like for me, I use web check-in all the time, and I request a clinic right down the street from me. And I say, well, I'd like to come in about 6 p.m. tonight. And sure enough, the clinic will call you within 15 minutes and tell you, we'll call you back within an hour and let you know what time we're reserving for you. So it's very efficient. I've always gotten in on the same day, even in the evening. So really encourage you all to use the web check-in service. Obviously we accept almost every insurance plan. I know that we're going to talk about our discount program, which is separate, but we also accept Medicaid and Medicare. We do have some on-site labs that we do. A lot of our labs are on-site, but we also do send out labs. And then we can get the results to you. We can send it in a secured portal so you have those results. We do have X-ray on site as well, and EKG on site. So again, we offer urgent care obviously in person and telehealth, but also we do offer work injury services if that's something you should want to discuss further. So we are accredited by the Urgent Care Association, which is a very high esteemed accreditation. We are surveyed every year, every single clinic. It's a 5-day survey. It's not over in a quick amount of time. We have to be just completely high quality, have all our documentation in place. They observe the staff, they observe the patient care in terms of are the patients happy, the patient satisfaction scores, the quality outcomes. And so we're proud that we have had this accreditation for several years. A lot of people ask us, what is the difference between urgent care and emergency room care, right? And sometimes it can be a little confusing. Well, on the left, urgent care is a lower acuity service, right? So I think most of us really understand that if we have any of these issues, an insect bite or like a sinus infection, or we need an x-ray, we're going to go to urgent care. But if it requires more diagnostic testing, like if you have chest pain or head trauma, any type of major bleeding, you're definitely going to want to go to the emergency room. And I will say, if you come to a CareNow urgent care clinic and you require the emergency room care, we can get you there. We can actually pre-register you at one of our ERs, and we can get you right into the ER. So they're expecting you when we file that pre-registration communication. Next slide, please. So really, what is it that, we see that employers and employees need, and that includes all of us, right? We all want quality care outcomes. We want good results. We want it to be affordable, right? We want the locations to be very convenient near our home and near our place of work. We definitely want some advisors that are going to promote good health for us, right? So if I had some lab work done and it came back that I was a diabetic, our physician would coach me and let me know what I need to do. Also would prescribe me medication if that's needed at that time. So it's a full service that we offer. And of course, we want to be as efficient as possible. We do monitor our wait time. So if you come into the lobby, that starts the clock ticking. We're always watching that. We keep the time that you're waiting on a digital monitor, so we know exactly how long you've been waiting and get you in as quickly as possible. We also have seasonal services that we offer. Of course, you can get your annual flu shots. You can definitely get treatment for allergies. I'll mention that we also have COVID testing and COVID vaccines. We provide sports physicals for your children that are in sports activities, and also back to school physicals, which is really busy right now. Next slide, please. Okay, well, you can see here a little more detail of what we can do, which the reason we call it comprehensive urgent care is we're just a little more advanced, obviously, than a minute clinic, like a CVS clinic, or more of a full service clinic. So you see all of these items, just wanted to share that in case that is, something you ever need. We do splinting. We definitely do a lot of eye care and, obviously ear, nose, and skin. We can drain an abscess. We can do laceration repair. We do see a lot of lacerations with, construction injuries or what have you. So we've got pretty advanced laceration repair as well. Just a little more listing of the services. We do splinting. As I said, we offer EKG. We do some wound care and even minor burns. Now, if it's more of an extensive burn, we're going to send you over to our burn center. We have burn centers in every market, so we're going to make sure, if it's more advanced or serious, obviously we want to get you to the right level of care. And we also obviously have all vaccines. Any vaccine you might want available, you might want to access, we offer it. We're fully stocked. And so this is our discount program, and it's been around for a very long time. We started it years ago. We partnered with Reagan's organization. We work very closely with New Benefits. And this is our CareNow Healthy Savings Program. It is only $18 per month per member, and that includes the entire family. We offer, obviously, all of these services that you see here. We offer behavioral health services. We can connect you with a behavioral health counselor. We can even get you to a higher level of behavioral health care if you need that. As I mentioned, it covers telehealth visits as well as in person. There's many discounts that our hospitals are in that you would have access to. Again, discounted specialist care, physicians, hospital care, which can be very expensive. And Reagan's going to go into more detail on that. We also offer savings on retail and mail order pharmacy. And as we know, sometimes pharmacy medications can be really expensive. We can get you a discount on that. Dental, we offer discounts on dental work as well, including cleanings and crowns. Vision, this is a popular one that people access. We offer up to 60% off of vision resources there. And then diabetic supplies. So as I said, Reagan's going to go into this more deeply, and he'll tell you how to access this. But when you think about it, $18 per month is really affordable for most people, for their entire family. And then when you do come in, it is a $68 visit, which is well below the average visit rate that you would have to pay if you paid like a self-pay rate, let's say. It would be 2.5 times that at least. So just want to underscore that. I'm going to turn it over to Reagan now. He's going to share some more details about our program.
Thank you, Beth. And as Alec and Beth both mentioned, our focus with this program through Healthy Savings is really more of a comprehensive approach. It's not just about being able to pick up the phone and talk to a doctor. With the CareNow program, it's about being able to go into a location, actually be physically touched and felt, and the temperature taken and blood pressure and everything that needs to be done to maintain a healthy lifestyle or in an emergent situation. But most importantly, it's the expansion of services into vision savings, dental savings, the prescription savings, all of the things that Beth has mentioned. And ultimately, our focus is about affordable care. Obviously, the healthcare system is very expensive. If you go to a primary care physician and you pay out of pocket, you're going to be spending a lot of money. And if you have a family of 4, that's quite a heavy lift. But it's also about promoting a healthy lifestyle. having access to vision savings and ensuring that not only you, but your spouse and your legal dependents have the ability to go and have their vision checked, discounts on frames and lenses or contact lenses based off of the need, the dental health, because what happens with your dental health affects the overall health of your body. Many studies have shown that heart disease, an early indicator is poor dental health. And so having access to these benefits and being able to provide them to your employees of your restaurants, of your locations at a discounted rate, $18, as Beth mentioned, for them and their family to be able to have these savings. Again, it's about promoting that healthy lifestyle, but also expanding the services that they have access to. Because this is available to an entire family, what we're able to do, and Alex will show on the next slide, is provide easy ways of access to the benefits. So we provide multiple access points to receive these savings and to utilize your services. Most importantly, there is a mobile app that individuals can download. We are going to mail out when they sign up in a location, in a CareNow location, or on the Texas Restaurant Association website. We are going to mail out a membership booklet and 2 cards to that primary member. What's great about it is that one card will serve for the entire family. So we do not have to list out a spouse's name or a dependent's name. They will be able to utilize it as a family benefit. And that booklet is going to detail what all they need to do to gain access to the program. We have a mobile app through a program called My Benefits Work. Again, it's detailed in the guide that they can download on both iOS or Android devices. On that mobile app, they're able to gain access to each one of the services that we've talked about today, how to utilize it, immediate access in, or linking out and sending them to the appropriate CareNow location and detailing where those locations are. And then we also have a customer service center that's available Monday through Friday from 7 to 7 Central, 8 to 5 on Saturday, where our member services team can answer questions on these programs and how to utilize them for the family members or for that primary employee or member. Most importantly, all of these services, from the print to the mobile app to the web portal that mirrors the mobile app, and our customer service team, are both available in English and Spanish for those that whose primary language is Spanish or where they're more comfortable speaking Spanish. So our whole goal here is to make the engagement of this program as easy as possible, promoting a healthy lifestyle by promoting access to easy savings on these services, and making it an easy access point for these individuals to utilize it so that they know that they have access to really, really great benefits. Beth, anything you'd like to add to that?
I'm going to add one small detail that as an employee, obviously, you can access the Healthy Savings Program, but also employers, if they wish to, they can cover the cost for their employees. So just, either way, right, Reagan, is fine with us, whatever you choose to do. Just wanted to add
Absolutely.
that.
We have actually already been contacted by a few organizations that are interested in making this more like an employee benefit that the restaurant is wanting to provide to either their management staff or even their all of their staff members. What's great about our benefits is they're non-insured. That means there are no eligibility restrictions. Part-timers, non-benefit eligibles, full-time employees, all of them can have access to these benefits. There is no restriction. And you can even have a new hire that has just come on board have access because there are no waiting periods. Because there's no insured component to this, you can also utilize these benefits as often as needed. So from a vision and dental standpoint, typically when you think of an insured benefit, you can only use it so many times a year. With our program, you can use it as often as you want. And because it's not insured, there's more services that are provided at a discounted rate.
I'll just mention just a small detail too, that we do have a concussion evaluation and management program. Unfortunately, concussions do happen. And just FYI, if any employee, should have a concussion, we do offer that service as well. As I mentioned, COVID testing, it's still, obviously being used. Again, we offer the vaccine. We have the added rapid test, so you can get your results in 15 minutes. We also have the PCR test, which sometimes is required. That is a send out lab test, and usually we can get the results back within 36 hours. And so we've got an entire gamut of COVID level resources for you. And we still see cases, as everyone knows. So I just want you to know that's available for you and your family. I mentioned the web check-in, and I really wanted to kind of emphasize that that's the easiest way to get in. So you don't have to wait at all. You simply log on to our website, CareNow.com, and you can find a location near you and click on that and request a web check-in. And then you fill out 4 pieces of information. You submit that. The clinic of your choice will call you within 15 minutes and will let you know when to come in. So again, it's a really convenient service, especially if you're at work and you want to, you want to go later on, but you want to make sure that you have a reservation, if you will. This is what it looks like. Pretty simple, questions, obviously. If you don't answer the insurance question, they will call you and you can say, I have healthy savings or what have you. So that's our presentation today, and we look forward to serving you all. Again, about 100 locations and growing in Texas. We're here to answer questions or help you in any way. So thank you for the opportunity to share our information. We appreciate it.
Beth, we did get one question, and that was, will a member know the total cost before treatment? So obviously, if it's a virtual visit, it's $39. If it's $68 for an in-person visit, but is there any other? Will they get an idea of what it's going to cost the member at time of check-in, or how does that work?
Yes, I can tell you in the clinic, prior to any additional services that may be required, that is going to be communicated to the employee, and they're going to make a decision if they want to pursue that or not. Reagan, you might have also another comment on that. There won't be any surprises. I can tell you that.
And on the additional services, it's a few of our benefits provide upfront pricing. For example, with our dental benefit, there is a dental pricing tool based off the provider and the procedure or the service that you're wanting to have rendered. There is an upfront calculator that would show that cost. With the pharmacy benefit, you can actually price out an estimated cost of the prescription at the location that you're wanting to go to and have it filled at, and show what the discount will be with where the discount is applied. With any of the other services, it is a point of service discount that is provided at the time of checkout. However, based off of whatever service you're having done, you can always ask for what the discounted rate will be prior to the service happening. So for example, if you go into an ophthalmologist's office and want to have just a standard vision check, you can present your Healthy Savings card and just ask them what is going to be the cost with the discount applied, and they will tell you before the service is even rendered.
And Beth, we got an additional question in regards to COVID testing, which tests that you offer, and then the rapid and the PCR. Can you just mention what that would be, and what would be the cost?
The employer cost would be, depending again on the PCR or the rapid test. I believe we have a discount for employers as well. I believe it is $40 for the rapid test, and I want to say it's 55 for the PCR, but that's way under the insurance, the insurance cost, if you will. So it's significantly discounted.
That's great. Now, are there any other additional questions? Well, thank you.
Oh, sorry, Alec. I was just going to mention to the team that I'm sure that we really want to, make sure everyone knows how to access this information. So, Reagan, do you want to give the website again? And of course, it's going to be communicated out to the members, but I just want to make sure that, because a lot of your questions will be answered by the detailed information on this link. So, Reagan, could you provide that new benefits link again?
You're on mute, Reagan.
Yeah, let me pull it right back up. It was on one of the slides. Give me 1 second here.
Well, I mean, honestly, for our members, the easiest way is going to go to our partners, basically who our partnerships are, our member value partners, and click on CareNow, and that'll take you to a link to be able to register for the program.
Okay,
Yeah,
great. That's right.
Yeah, under member benefits, CareNow.
Perfect. All right. Well, we appreciate the opportunity and look forward to partnering with you.
Thank you so much, Beth and Reagan. I appreciate your time today, and I feel very strong. I think this is a great program and something that will provide a lot of value to our members and their families. And again, it's not, and why we like it so much is it's not just the urgent care visit. It's a comprehensive solution, includes behavioral health, and includes dental and vision and all those great programs that really impact families today. So as you look to build out your suite of, just like I've tried to build out a suite of solutions for our folks, I'm sure you're looking to find ways to attract and retain talent, and being able to offer something like this is a great way to do so. So thank you so much, and I wish everyone have a great rest of their day. Thank you.